Hi everyone. Few students emailed me asking me why does SIADH cause hyponatremia. So let's talk about that. The issue with antidiuretic hormone is we did study together that it is reabsorbing both water and salt, although water is proportionately higher than salt. So the normal function of ADH is to increase aquaporin 2 and 2 or just number 2, and that will increase the water reabsorption at the collecting duct. We know that. We know that this is a little balanced by not completely balanced. We still are reabsorbing more water than salt by the fact that also ADH will increase the NKCC, it increases the NCC, it increases ENaC, increases all those fancy transporters that we studied together, and so therefore they also increase the sodium reabsorption, and it increases the UTA transporter, although it doesn't have much to do with the sodium. So the question is, if it's only proportionate, is it enough for you to cause hyponatremia? Well, let's consider that a little bit. You are retaining water and salt. So initially, for the first, a day or so, you have increase in volume. So there will be hypervolemia. Increase in volume. Okay? And the expansion in the volume, as we studied, it will result in increasing the atrial natriuretic peptide. So, because the atrial natriuretic peptide is going to inhibit these guys, right? And it's going to reduce the sodium absorption, sodium reabsorption. Now you're left with way more water reabsorption than salt. So just by itself, the antidiuretic hormone increases the water reabsorption than salt. But because the compensation comes on top of that, because of the high volume that we will end up in the next, following one day or so, then the atrial natriuretic peptide will really slow down even the salt reabsorption, resulting in majority to have water, and that will result in diluting the serum or the plasma, and we will end up having hyponatremia. We're good with that? There is one thing here that we keep saying that, well, why is it that there is no shift? Why is it that there is euvolemia? We don't have to remember that. But as I mentioned in the lecture, after long-standing hypotonic or hypoosmotic extracellular fluid, because we appreciated now there is hyponatremia, so therefore there is hypoosmotic extracellular fluid. And so the question is, why don't our cells start swelling and just keep growing big? The reason for that is that the cells will give up some of their salt when it's constant hypoosmotic environment, and by giving up some of their salt, then they will become as hypoosmotic as the extracellular fluid. So therefore there is no movement, there is no shift of fluid into the cells, which is in a way good, because you don't want cells like in the brain to swell. Again, it gave up potassium, they gave up phosphate, and when you're giving these things that were otherwise inside the cell, then the cell is also hypotonic. And that's why I told you in the lecture, if you see a patient with hyponatremia after long-standing SIADH because of a tumor, because of inflammation, infection, whatever, then try not to give suddenly sodium chloride, because if you give sodium chloride, then suddenly the osmolality of the extracellular fluid is restored, and by restoring that, the osmolality of the cells is still hypoosmotic, and therefore there will be sudden shift of the fluid from the cells into the extracellular fluid, from the cytoplasm and the extracellular fluid, and that can be fatal. And in neurons, that can result in sudden demyelination of the neurons and sudden death. And so we don't have to remember that last part, but I'm just trying to explain to you particularly why in SIADH we have hyponatremia. And of course, because we're removing a lot of the water from the urine is really hyperosmolar because there's a lot of salt in it, and the water, you keep removing the water by the aquaporins, so it results in hyperosmolar urine. But if you look at the plasma, it's hypoosmolar, and there is hyponatremia. Hopefully that answers your questions when it comes, well, why does the antidiuretic hormone cause hyponatremia? I'll stop here and I will post that for you.